Doc, Dr. Habib, the man. How are you?
I'm doing great, Vic. It's Friday, so great
Yeah.
to
Yeah,
start the
no,
weekend strong.
the smile's a little bit bigger. I get it. um, so let's just do a quick intro because I know these first few episodes we're always going to have new listeners. So why don't you tell the folks just a little bit about yourself, a very brief bio, and then I'll do the same.
Great. So I'm the medical director at Next Health, which is really a medical practice focused on longevity, health, lifespan, wellness, and um, and so the aim is for us to ideally predict and prevent disease, and if we find them, we can reverse it.
Yeah. Okay. Great. And how long, just out of curiosity, Doc, you are an MD, a practicing MD. How long have you been
That's
an
right.
MD?
That's right. Well, I graduated as an MD from the United Kingdom in 1993, and I've
Okay.
been practicing in America since 2000. That's when Next Health started its roots, I should say.
Yeah. It's a journey. Okay. And just a quick tidbit about myself. I am an exercise science major. That's what my undergraduate degree is in. And I am the partnering lifestyle and exercise specialist for the Next Health weight loss program. And Dr. Habib and I both share similar viewpoints on what needs to happen in the medical care system in our country and the approach to taking care of oneself, generally speaking, and trying to shift the focus from being reactive to more proactive in an effort to enhance not just quantity of life, but quality quantity of life. So, with that being said, this is our third episode. And what I posed to Mr. Dr. Habib here was that we just discuss a little bit about our own routines, some of the things that we do, because again, hard for people to take with any seriousness or without any sort of hesitation advice from people who don't practice what they preach. At least in my opinion, that's how I view it. So I thought we could go through a little bit about what our daily routines look like in terms of the things that we do from a dietary standpoint, to an exercise prescription standpoint, to even some of the alternative stuff that we really believe in and we find fascinating and extremely beneficial. Some people refer to that stuff as quote unquote biohacking. I don't think it's hacking. I think it's interpreting, right? So, my first question for you is, let's talk just a little bit about the basics. So, just an overall approach. In your opinion, no, not even in your opinion, in your practices personally, what are the, let's say, top three things that you focus on, not necessarily on a daily basis, but over the course of a week or several weeks? What are the things that you really try to check off the big boxes, just to maximize your quality of life?
Yeah. Well, I mean, I think that you did say it's about mine, but what applies to me applies to my patients. I think that's kind of why we have a nice balance, because the kind of clients that come to us are the kind of clients we like to serve. And being proactive is the operative word, right? And so long as a client is willing to make some changes, my job is to help them make it easy to get the results they're looking for. And that's why, as a medical doctor, we've got ways to identify true risks. So we know how to engage with the individual, what urgency, and yet doing it in a very nice way. I would say that so the priorities are the same. I have bad genes and I have priorities. Whether my patients have bad genes or not, it's the same priority. And I thought you'd start off with what do I do first thing in the morning. We can do that later.
Yeah,
Cold
no,
shower, I was going to
no,
say.
that's perfect. So let's do that. Let's just take
Okay,
an example of a day. Yeah, what does a typical day look like? And let's say
exactly. Let's start with
the ideal day. If you could
yeah.
fit it all in on the perfect day, life doesn't really throw you any curveballs. What does your perfect day look like in terms of taking care of yourself?
Yeah. Well, the perfect day starts only if you have a good night rest. So
Yeah,
as I've
right.
got older,
Sure.
I've tried to emphasize to people that if you go to bed at a good time, and I'm going to go into a little science in a minute as we go back and forth, if you start off by going to bed at the right time, because the circadian rhythm actually can confirm what the right time is. It's not about how much sleep, it's the quality of sleep. And that's depending on timing even more than duration. Both are probably important. If you have a good night's sleep, you start off well with energy. And so,
Sure.
what I try to do, if we want to elaborate on sleep first, but then I like to go have a cold shower in the morning.
Yeah.
So, I want to talk about both of those things.
Yeah.
How about you, Vic? What do you do?
So I would agree. I think we can come back to the sleep to cap off our daily routines, but 100% that is where I think you set the tone for the upcoming day. But for me, first thing in the morning is honestly is a little bit of gratitude. I find that if I, before I get out of the bed, I just try to focus on one or two things that are going really well. They can be small things, they can be big things. Um, Setting the mindset for the day in terms of just trying to focus on positivity. I know to some folks that might sound a little cliche, but or silly, but I really think it makes a big difference when you start the day with trying to focus on something that you're grateful for. And then much like you, when I am being a good boy, cold shower, or some folks call it a European bath. I've heard people call it that before, but again, just a couple of seconds to a couple of minutes maximum at the end of a shower if I do any warm. And just to make that distinction, when you look at the literature, and I'm sure you know this, but if you want to reap the benefits from the cold shower, if you want to maximize those benefits, I would always suggest if you have to have some warm in your shower in the morning just to get comfortable with the idea of being wet before you get comfortable with being cold and wet. It's tough to do. Warm shower, but finish with the cold. Or if you can muster up the courage, just cold. So 100%. Okay. So you have a cold shower. What's next?
Well, let's elaborate on the science behind that, if you don't mind, for a couple of minutes.
Yeah.
And so I think what you said about being grateful, I think whether you do meditation or mindfulness, what we're saying is that that sets up what we think is the vagus nerve stimulation. And that is then compounded with that cold shower. So your technique is, I think, the right one, where if you can get your body wet first at a comfortable temperature maybe, and gradually bring down the temperature so it's not such a shock. But if ever you want to try it out as a test, when you put really cold water on your head, why do you get that? It's because your heart rate just plummeted. And that's the value of resetting the autonomic system. So when you're mindful, when you're meditating, when you're doing deep breathing, you are setting off the parasympathetic, which is part of the vagus nerve. And the cold shower would do the same thing, particularly when it's on your head. How about
you? So a lot of folks hear about the benefits of cold and they're sort of confused. Doesn't make sense. And of course, like in everything and anything, there's considerations you have to make. So for example, if you have any significant cardiovascular health concerns or things like that, you want to be careful about sending your body into potentially fight or flight, right? Because like you said, the vagus nerve, which is stimulated by cold exposure, sort of is the conduit and the control between our fight or flight and our rest and digest aspects of our autonomic nervous system. But if you really want to maximize the benefit from that cold exposure, the idea is to try to avoid having a uncontrolled reaction to the cold. So you have that gasp reflex to the cold. The trick is to try to embrace that and to try to relax in that moment. And the thing that I really like about cold, and I'll tell you to be 100% perfectly honest, there is a noticeable difference in terms of my mood, in terms of energy levels, in terms of all sorts of aspects of my life when I look at days where I do start with a cold splash and days that I do not. I find that I'm more patient. I find that I'm generally happier, a little bit more energetic, a little bit more focused. And some of that is due to, like you said, when you have that reflexive response to the cold, lots of things happen in the body. One of which is this massive spike in adrenaline or epinephrine, depending on what you've heard it referred to as. But adrenaline, epinephrine, same thing. But there are links to elevated circulating levels of epinephrine and upregulation of the immune system. So you kind of fortify the immune system. Not just that, but again, all of those things that come with that elevated level of adrenaline, the focus, the maintenance of appetite or satiation. Sometimes people find that cold keeps them from having those early morning hunger pangs. So if somebody is really trying to stick to some intermittent fasting or something like that in the earlier part of the day, that's an additional benefit that you might find you have from a cold splash. But for me, when I do have a cold splash in the morning, it really does set the tone, especially if I've paired it with a little bit of gratitude practice on the front end. And if you really want to maximize the challenge of that, you have to understand that it's just like anything else. It's a progression. 30 seconds at fairly cool water may be enough to sort of give somebody a response. You don't necessarily have to go and sit in an ice bath for 30 minutes. And I was listening to something the other day, and I really liked this individual's strategy or suggestion for cold exposure for people who are getting started is don't worry about a specific temperature or specific time. Find a temperature that's uncomfortable and listen to your body. And if you're getting cold enough or uncomfortable enough where your body is sort of telling you, hey, let's get out of this cold shower, then you're at a happy, you're at a good spot. And then with time, what you can do instead of worrying about adjustments to temperature, or especially if you're doing it at home and you don't necessarily know what the temperature of your water is, or for tracking time, is start thinking about how many of those urges to get out of that environment can you make it through, because they pass. You kind of get that sense like, ooh, okay, this is getting cold, I got to get out. And then things sort of settle down a little bit, and maybe you find a level of comfort, but very likely then in some period of time you're going to experience another push to get out. So what I would say is, just generally speaking, is be mindful of any sort of cardiovascular, if you've got really high blood pressure, anything like that. If you have any significant cardiovascular concerns, definitely consult with somebody before you start to implement a cold immersion or cold splash protocol. But for people who are otherwise healthy and want to give that a try, is focus on just getting uncomfortable, and then focus on how many times can you get uncomfortable. And you don't need to push it past that point of, okay, I feel like I'm starting to shiver or anything like that. And there's a ton of physiological benefits that come along with it. So for example, and this is just, I don't want to get too deep in the weeds on this particular topic because we have a lot of things we can cover today. But as you know, the difference between beige or brown adipose tissue and white adipose tissue, and the functions of those different types of fat. So adipose meaning fat, brown fat versus white fat. They have different metabolic capacities, and they can act as different sources of fuel and can be utilized in different ways in the body. So cold thermogenesis, or getting into that cold shower, is actually a really good way to start to stimulate the conversion of some of that white fat into brown fat, and brown fat can be used to regulate core temperature, can increase metabolic rate. So for somebody who's looking to lose body fat, for example, it's a good way to sort of speed up the metabolism first thing in the morning to a certain degree. And the list goes on and on. So I think at some point we could probably do an episode purely about cold immersion, cold exposure. But you know me, just like you, I like to talk. So before I get down any more rabbit holes, I'm with you so far. First, everything is laid upon the foundation of a good night's sleep. We'll talk more about that. But then first thing in the morning for me, gratitude. And then much like you, cold splash.
Well, the next step, I think, leads well to then what you do. Do you have breakfast? Don't you have breakfast? And what would you take in? So for my part, the idea of breaking fast is not a good idea for me, because if I've finished my meal at 8 p.m., 8:30 at night, and I'm up at 6, whatever, and now it's sort of 8 o'clock, that's 12 hours already. Why would I want to break my fast? So I don't choose to break my fast. Instead, I want to continue that fast, and we'll talk about the benefits of fasting as we add the hours to the day. Sure. To really be fasting. However, morning to me doesn't seem like much of a fast. So, but what I do is have a cup of coffee. I like an Americano, which is an espresso and a little bit of hot water. And there are some benefits of having caffeine, and that it can be from dark tea as well. Now, like with anything, moderation is the key, and sourcing it from good sources, things with less mold and more pure quality would be the way to go. But the point is that whether it's caffeine from coffee or from tea, that actually can reduce the incidence of diabetes as well as dementia to some degree. Now, that's, what Vic mentioned earlier on, is that, this is what we're doing today is for education purposes. This is not for diagnosis and treatment. You really ought to go to your own doctor before you get those final information. We're educating you so you can ask your doctor better questions. We're educating you so you can contact us. So if people want to contact Vic or me, I'm going to go first. You can contact us at 703-724-4000. That's 703-724-4000. You can text us, call us, and then the website is nexthealthmed.com. Next, NEXT, health, HEALTH, med.com. So that's how you can contact us. So we can actually go one-on-one and give you that information. We can even do remote physicals where we send kits and then we go over it remotely and then send supplies based on our findings. So Vic, they can contact you as well.
Yeah, no, if they can find you, they can find me. Just find
There you
those
go.
guys at Next Health, and if you're looking for me, they'll direct you in the right direction.
Perfect.
Um,
Yeah.
but okay, I agree with you. In terms of fasting, I typically don't like to break my fast first thing in the morning either. Because of my schedule, a lot of times I don't finish my last eating of the day until later in the evening. So much like you, for me, a fast is a minimum of 12 hours, but I like to shoot for days closer to 16 and even upwards of 20 hours. But the exception for me being with my schedule and some clients and things like that, I typically will get my training sessions in earlier in the day. Now, and by earlier, I mean by 5 a.m. or so. So I'm getting up and working out pretty much first thing. And with my training, I'm not particularly too concerned about having additional carbohydrates or additional fuel in the tank per se, because with my fasting and for the years that I've been doing it, my body has become pretty fat adapted, meaning that if I have had adequate calories the day before, my body does a pretty good job of running off of fat for energy when I'm in a fasted state. Now, with that being said, I do train pretty hard and I understand how the body works in terms of its preferences for fuel with varied intensities of exercise. So I try to kind of walk a happy medium. So I don't believe in breaking your fast with something that's high in carbohydrate or any kind of sugar for that matter. And the reason being is I just don't think that that's conducive to long-term health. I think it creates massive spikes in blood sugar and therefore in insulin release. And I think you can go about that a much wiser way. So, but what I will typically do is I will typically first thing in the morning is I'll have some essential amino acids. So for those who aren't really familiar with amino acid supplements, the typical one that most people hear about is a branched chain amino acid. And branched chain amino acids, along with all of the other essential amino acids, are amino acids that you have to consume the various building blocks of in order to synthesize them and produce them in the body. Your body can't produce them on its own without the right things. Essential amino acids is pretty much the full spectrum of all of those amino acids that you can't create endogenously within on your own. Branched chain amino acids are just 3 of those. The branched chain amino acids have really gained popularity in fitness circles and things like that because one of the particular amino acids of the 3 is the most anabolic in nature. So when people are trying to maintain lean mass or build lean mass in the gym, it's all been marketed towards branched chain amino acids. And don't get me wrong, they do have their place. But for me, getting that full spectrum of amino acids that my body can then use to help keep me from going into a tissue breakdown or a catabolic state seems to be a wiser move. So what I'll do is I'll get up, I'll feed my dogs after I get my shower. I'll get the coffee pot ready because much like you, I enjoy caffeine first thing in the morning. Then I'll have on my way to the gym, I'll have just some essential amino acids with some glutamine and some creatine monohydrate. And again, supplementation is a whole nother conversation, but those are the 3 things that I will take daily in the morning. And personally, I actually, although there's a lot of benefit to having some caffeine pre-workout, because I work out so close to the time that I wake up, and you and I are talking a little bit about circadian rhythm and trying to set yourself up for good sleep and just a good daily rhythm in terms of energy levels and things like that. I actually prefer to wait about an hour to 2 hours minimum after waking before I have any caffeine. And the reason for that is I just want my body to be able to wake itself and become alert on its own without psychologically or otherwise feeling as though I need caffeine to get up and to be able to be functional and productive. So I will typically go and work out. And then when I'm done and I come home, then I'll have my coffee. And I really enjoy coffee and I could drink it all day. But like you said, I try to practice moderation. But that's typically what I'll do. So I'll get up, I will I guess, technically break my fast, although those supplements that I take, that little cocktail of essential amino acids, glutamine, and creatine monohydrate, has almost no caloric value whatsoever, and no sugar or anything like that, nothing that would significantly spike my insulin levels. So I will do that as sort of like a cheat in feeling like I'm fueling myself a little bit for the workout without breaking my fast to a significant degree. And then I kind of feel like that gives me some room to capitalize on both an extended fast, but also getting my workout in first thing in the morning when it works best for me. And it's just the most conducive to my routine and my day-to-day schedule. So that's what I'll do. After that, I'll come home, I'll have my coffee. If it's been a really brutal training session, and this is an important note, if it's been a really brutal training session, I will make sure that I do have a meal within about an hour to an hour and a half after that workout is done. And when I say brutal, I mean something where it feels as though I've really pushed myself and kind of created maybe a little bit of damage, like a really hard resistance training session where I was getting a lot of burn, or I was a very, very intense bout of cardiovascular exercise where I felt absolutely drained after. But I do believe in giving yourself a half hour to an hour minimum after the workout, just so that you don't blunt some of the beneficial hormonal signaling that can happen. What are your thoughts there? Just your thoughts on my approach to that.
Yeah, I just want to elaborate on that so people can get the science behind what you're doing.
Sure.
And so the first thing is that, you're waking up in the morning, instead of having breakfast, which means to break your fast. Vic's idea is to go to the gym. And frankly, when you're going to the gym, you're not going to need the calories that you consume right before the workout. Your body has stores in the liver and the muscle. That's what he was talking about, having enough food the night before. That food is now stored, some of it as triglycerides in your liver, and there's up to 200 grams, milligrams actually. Grams. 200 grams of glycogen in your liver. And then you have stores in your muscle fibers. Those are broken down so that you can liberate all the fuel you need. And frankly, if you need more than that, the body can also liberate ketones from the body fat. So the key would be that that staying in the fasting state and then going to have a workout is actually a really, really good thing. And the common question would be that when you come back from the workout, do you have to eat right away? It depends on how old somebody is, right? If you are young and anabolic, that means you're young and growing, you can go ahead and eat right away, or, some people say within 2 hours, should we say, right? Their protein shakes or their meals. And I like what you said about if you have a really heavy workout, you might want to have your meal because you're listening to your body, right? Every day doesn't have to be the same. Every, meal and supplement doesn't have to be the same. But for people who are a little bit older, maybe over, say, 40, first of all, say 40, and then as you get close to 50, and some people think that that's really young, that's fine. I think you're only as young as you feel. So you could be 70 and have a biological age of 40, as far as I'm concerned. But we're talking about not the 20-year-old, we're not talking about the 30-year-old. That grace period is over. For those people, I think we are going to get more health benefit if we don't break our fast in the morning. If you choose to do a workout, do a nice little mixed workout, just like with Vic is more of an athlete, but the science shows that moderate activity where your heart rate goes up some, it doesn't even have to be double, where you breathe a little heavy, where you're sweating a little bit. And if you can maintain that for 30, 40 minutes or more, that's all you have to do to get the health benefits. Now, what Vic is doing is challenging himself with performance, and he wants to enjoy that feeling and see the results of that labor, and he's in his prime of his life. But for average people who want longevity and good health, and as you get over 40, you need to be thoughtful about it, because excessive exercise is excessive oxidation. It can break you down. Now, you can recover, but you have to, if you want to train hard, then you have to also work on recovery hard. That means supplementation and so forth. For the average person, I think it's reasonable to have a reasonable workout, a mixed workout, a mixture of aerobic and anaerobic, strength and cardio, doing intervals of the two types right away. I used to have days where I did cardio and the next day would be strength. And I found that when I combined the two, I actually had a higher HDL because my heart rate never went down because I'm moving from one to the next. And so that's what my advice is. That's almost a little bit like high intensity interval training, where you're doing a regular workout, but for 1 minute, it's all out. That's where the body is sort of tricking, and Vic can go into more of the science. It just sort of changes the results of that workout. But when I do a mixing of the cardio and the strength and the cardio and the strength and the cardio and strength, I got a total body workout. I can use different muscle groups on different days if I want to, but my HDL went up. And so we're coming to the work after the workout. If you've done a moderate workout, you don't need to eat 1 hour later. You don't need to eat 2 hours later. In fact, all you need to do is drink water. You need to drink water before you work out, maybe during, but certainly after. That's all you need. Because if you stay in a state of fasting, first thing in the morning, your body's releasing leucine, the most abundant amino acid. Your growth hormone just went up. Then on top of that, you exercise. Your growth hormone went up again, double fold. And so what you're doing is stimulating the growth factors. And so the more you stay hungry, the more you release growth hormone, but it's actually ghrelin. Ghrelin is the growth hormone that comes out of your stomach. That's why you feel hungry. And that ghrelin is supposed to tell your body to eat, but you're resisting. So the body makes more ghrelin. That's your growth hormone. It's your growth hormone releasing hormone. Now, there are peptides like that. They're called growth hormone releasing peptides. We use those as injections to help people sometimes. So if you don't break your fast, you're releasing growth hormone and releasing amino acids. If you exercise, you're releasing more growth hormone. And if you don't eat right away, then you continue to release these things. So, your 12 hours can become 14 hours. And for the average person, build it up. It could be 8 hours. Then it could be 9 hours. So you want to be able to... And sorry about that. I just
no, it's okay.
hit the wrong button. I got a lot of calls coming in. And so let me just quickly get rid of that. Okay. All right. And so the longer you can leave it, the better it is. And so now, all of a sudden you're going to 11 o'clock maybe. It's getting close. So if you can go that long and that's your breakfast, you've done very, very well. Yeah. Right. And then if you achieve that, then you can go to the next time and the next time, extend it further. Right. But you can go into the science of how to nourish.
Well, there's a many ways to skin a cat, right? So a couple things that you mentioned that I wanted to touch on. One is absolutely for the average individual who just wants to gain the health benefits of some exercise and wants to improve their various energy systems. You don't have to go into the gym and try to absolutely kill yourself. As a matter of fact, I would argue that the vast majority of people are going to do far better with a little less intensity and a little more frequency. And intensity, you can interpret that in a number of ways. You can define that in a number of ways when it comes to exercise prescription. But let's just look at it as total weight. So in terms of a movement, how much are you challenging yourself? So if we're talking about resistance training, let's just say it's the load that you're using. How much weight are you using on an exercise? If it's something that's more cardiovascular in nature, how hard are you pushing yourself? How high is your heart rate getting relative to your theoretical or your actual maximum heart rate? So how hard are you pushing yourself? I think most people will do better to keep that on the more moderate end of the scale, not necessarily low, but it's a spectrum. And I think you should try to work your way through the entire spectrum to some degree over the course of your training, whether that's over the course of a training session or over the course of a week or weeks or months. You should be trying to touch on all of those energy systems to some degree. But I think you should spend the majority of your time for the average individual in that moderate range. So I think we may have discussed this before, but most people are thinking, okay, what is low, moderate, or high intensity exercise? Talk test. That's a simple way to sort of navigate how hard you're working during a workout. If it's low intensity, you should be able to sing a song unbroken, no problem. If it's moderate intensity, you're pretty conversational. You can speak in full sentences and your heart rate's a little bit elevated. Like you said, you might be sweating a little bit, but you can still hold a conversation. And then high intensity is anything where you're having trouble speaking in more than a couple of words at a time without having to gasp for a breath. So most people should be thinking, when I'm working out, most of the time, I should still be able to hold a conversation with somebody. My heart rate's a little bit elevated. Maybe I'm a little bit sweaty, and that will do. And the reason I say that is because all of the beneficial responses that our bodies have to exercise have a very short, a relatively short half-life. If you go too long between workouts because you've had an extremely intense workout and now you're so sore that you can't work out for several days, you really lose the opportunity to build any momentum in terms of those beneficial shifts in your performance or your overall health, whatever aspect that might be. So for me personally, I try to train about 5 days a week on average. 4 of those workouts, typically, if I was going to rate them on a level of intensity, 1 to 10, 10 being, like I said, maximal effort, 1 being I could do this all day, probably in the neighborhood of 6 to 7. So for me, that's relatively moderate in my mind. Somebody else might classify 6 or 7 as kind of high. So again, just think about that conversational talk test. And then one of them is a little bit more brutal in nature. But for somebody who's maybe only training a few times a week, 2 times a week, you may spend 80% of that workout conversational, and then just have a few minutes where you really challenge yourself, like you said, and maybe in a hit style manner where you're going to get on the air bike or the elliptical or something, and you're going to work as hard as you can for 10 or 20 seconds, and then take 10 or 20 seconds to recover, and just try to do a couple of rounds like that. Even maybe just 30 or 40 total seconds of actual really hard work. But during that work, you're really pushing yourself. So again, always a good idea to consult with a professional, right? You have to take into consideration your health and any underlying conditions that you have. So before you start any sort of exercise or nutrition program, you should always refer to your physician or a physician's advice. And then you should work with professionals, I think, especially if you're a novice and you don't really know what you're doing. You should have a team, whether it's a personal trainer, a coach of some kind, a nutritionist, a dietitian, a physician, a psychologist, whatever it is, or a collection of those individuals who can help you, number one, assess your abilities and where you are and what is a safe place for you to start at. And 2, can help kind of guide you and teach you things along the way so that at some point you do feel as though you're proficient and you're self-reliant with that stuff. But for me, I train 5 times a week on average. I'd say 80% of the time it's modest to moderate workload. And then 20% of the time I'm kind of pushing myself. What about you? So I work out first thing in the morning. That's my general approach to my frequency and my intensity. What about you, Doc? Time?
Well, I think the way it used to be when my kids were much younger is that I could, whilst they're sleeping, I could just go and get the workout done. There's some value in that. Morning is when you have the cortisol surge, and that's the right thing to do because that's when you wake up and you have to raise your heart rate and your blood pressure before you get out of bed. And if you didn't have the morning awakening cortisol rise, then you'd collapse. So that can be exaggerated in people who are under stress already, not sleeping very well. So this morning exercise can blunt that so you can be more relaxed in the day. Having that cold shower resets you so you can have a more relaxed day for the rest of the day. It lowers your heart rate, resets your vagal nerve tone. And so I would say is that morning is a very, very good time to work out. But as the kids got older, I found that, I'd have to take them to school in the morning. And then it just so happens that I'm enjoying my studying in the morning. That's when I study best. So I am doing my exercise later in the afternoon when I finish my work. I tend to finish work early, so I could go into the gym, 4 o'clock, maybe 5 o'clock, maybe sometimes earlier. And the problem with me is that if I eat before I work out, I can't have a really good workout. All the blood rushes into my gastrointestinal system. And I don't know about other people. I must have a lot of blood in my gastrointestinal system. I don't have enough blood to do a good cardio workout. Maybe I could do strength training, but I'm never satisfied doing just any one type of exercise. Before I talk about my workout, I just wanted to say what Vic mentioned. I think it's always a good idea to start at a lower level, right? So when we talk about 6 out of 7 or 6 out of 10 or 2 out of 10, it's all relative. It depends on how conditioned or unconditioned you are. So when you're unconditioned, you could be 7 out of 10 and you're barely, breaking a sweat. So the idea is to get yourself conditioned, and the definition of that is no rocket science. just improves the duration. And then as the duration gets longer, your muscles get used to it. Then you can increase the intensity. And then we can talk about 2 out of 10 or 10 out of 10. And so part of the cardio is that if you warm up, you'll find that you can actually go longer and harder. But if you start hard, your lactic acid builds up and you feel like pain and you want to stop. In the same way, if you do a heavy set, you might injure yourself. If you do a light set with lots of repetition, you're warming up the muscles, you're getting the range of motion. So the next set could be heavier and you could do fewer reps. So the way I say it, the way I do it, I do a very light cardio, then I do a light weights, then I come back to the cardio, go faster. Then I go back to the weights and go heavier. Then I come back to the cardio. So I'm going in an up manner and then I'll come in a down manner. With the strength, I'll go in an up manner. And now that's on a, like you said, a moderate workout. Yeah. And if I was going to do this high intensity, and because I'm older now, if I'm going to do it, I'm going to only do that maybe once in the week so that the other days are moderate. Now, I could have had a really good workout and I'm sore, but I won't just stop. I may do a lighter workout, right? Sure. Frankly, I'm not doing that heavy workout because that soreness, like you said, Vic, you're exactly right. What happens is that you feel so great. You have such a fantastic workout because you slept so well and you've gone really maxed out on your cardio. And then you need 3 days to recover. And then you're like, well, you've lost a routine. And you're exactly right. It never feels satisfactory. But that moment of achievement is very satisfying. Oh, right. But as you get older, it's probably not a wise idea. When you're younger, I think you can get away with a lot more of that. So just going back to what I do is that I try to stay in a fasting state all day long. I have my coffee because it improves my adrenaline and makes my brain receptors like dopamine work better. I'm actually sharper. You actually make more nitric oxide. It stops it's called phosphodiesterase esterase. It's the thing that breaks down nitric oxide. Well, caffeine stops it. Okay. Viagra stops the breakdown of nitric oxide. That's why you get more blood flow. So your exercise is a great way to stop the breakdown. Exercise, it makes nitric oxide and your coffee stops the breakdown of that nitric oxide. And so I want to stay in this fasting state. I drink water. I may have some beverages throughout the day. I don't want to eat until I have my workout. My workout is anywhere from 50 minutes to an hour. It's now I'm more moderate about it. And then I'll eat once I've gone home, had a shower, and relax. That's kind of my workout.
Okay. Well, I like you, I try to keep my workouts to about an hour. And then I typically do add some time in the sauna on the back end of that, as long as I have the time. But if it were up to me, I would 100% prefer to train the time that you're training. And that's because, one, I really like the way I feel if I'm able to have some coffee before a workout. I just feel that much better, that much more alert, that much more in tune with what my body's telling me, more focused. But the other thing is things like grip strength, and some other things like that sort of peak in the mid-afternoon, late afternoon, right? So that you can have a little bit of a better performance and again, have some more beneficial psychological feedback from that. But with that being said, one thing that you mentioned that I think is important for people to understand is that, you don't have to be, especially if you don't have guidance, you don't have to be extremely structured with your approach to your workouts. The goal is to try to get in there, move, elevate your heart rate a little bit, sweat a little bit, make those two things your primary focuses. You'll be able to push yourself a little bit harder with time. You'll be able to get more detailed with your training if you choose to with time, and try to figure out ways to continue to progress. But for most people, especially if they're just getting started or back into a routine, just being active with consistency. So again, more frequency. I'd rather you do 20 minutes of light exercise a few times a week than to do an hour and a half of exercise really, really hard once a week, personally. The other thing I wanted to mention, you mentioned nitric oxide. So this past week, I've been doing what we refer to as a deload in my training, meaning I've scaled back my volume and my intensity, and I'm allowing my body to recover a little bit, and my mind. It's hard to push yourself constantly with anything, right? So I'm hitting a bit of a reset button, and this is strategic. If you look at any sort of athlete, there's cycles to their training season based on the other factors that they have to consider. So are they in competition? Have they just finished a season and their body's beat up? There's all of these things. What most people don't realize is that as just the general population person, like we have those same sorts of stressors in our lives, and those all impact our ability to recover and what we should be doing in terms of adding additional stress to our lives. And exercise, although it be eustress, meaning a good source of stress, if you overdo it, and if you've got a bunch of other stress compiling, then it can start to have some detrimental effects. So this going back to the nitric oxide, this week, one of the things that I've been doing, because again, I'm trying to keep it simple, when I'm doing my workouts, I don't allow myself to do anything that prevents me from being able to breathe through my nose only. Okay. And the thing about breathing through my nose only is, as you absolutely know, that nasal breathing has impact on nitric oxide production, right? Could you maybe just give us a little bit of science behind how that works?
Yeah, I mean, so a couple of things. Number one, I incorporate that myself. So, top athletes, they try to get themselves so conditioned that they can only breathe through the nose, because that maintains the nitric oxide. So the idea is that as you breathe through your nose, the stimulation releases the nitric oxide. So when I'm working out, I try to breathe through my nose until I can't breathe through my nose. But even then, when you raise the intensity, you can sort of, the way I would do it is breathe in through my nose and then breathe out through my mouth, because I can't do both because my intensity now is so high. And then if I go even higher, then the nose is out. Then I'm like,
picture it like shifting gears, right? First gear would be in through the nose, out through the nose. Second gear, in through the nose, out through the mouth. Third gear, just get it in and out however you can.
Yeah.
Okay.
Yeah. But the point about doing the workout is that, well, that's actually helping you with your performance and your endurance. If nothing else, you've got the health benefits. Now, the science of nitric oxide is that it's actually part of the disease model, but they don't talk about it. So people don't even know that that's where the disease comes from. And we spend a little bit of time on it, because this can be a lead to how we break our fast. What are we eating? So the nitric oxide can be generated from exercise, because as you exercise, the movement of blood through the blood vessel wall activates an enzyme called NOS, and you release nitric oxide. Nitric oxide is a vasodilator. It opens up arteries. When the arteries open, more blood can flow. When arteries open, then blood pressure can come down. So the reason why people get blood pressure, hypertension, is because the nitric oxide level is reduced significantly. It's not the case for 100%, but a lot of the people. So there's two ways, in fact, three ways that you can make nitric oxide. One is exercise. The other one is by eating your green leafy vegetables. Those are your nitrates, and the bacteria in your body make it into nitrite. You need acid in your stomach to release nitric oxide. So people that are taking acid-lowering medicine because they have acid reflux and gastritis or things like that, they're doing themselves a disservice in the long run. So the answer is to fix it. And you don't fix it by taking Prilosec and Nexium for the rest of your life. Right. And the problem is, if you don't change your diet, you'll be taking for the rest of your life.
Sure.
And if you don't release nitric oxide, you are setting yourself up to getting premature hypertension. Mm-hmm. That's one way of getting hypertension. So if you don't exercise, you're setting yourself up for blood pressure, especially if you have the genetics for it. If you have acid reflux, that means your acid was never ideal to make good nitric oxide. And if you shut it down with the medication, then you will have suboptimal nitric oxide. Those people, it's not if, they will develop blood pressure over time. In fact, they actually, because of lack of acid, will not be able to absorb nutrients like calcium and magnesium, which are important for bones. So people's bones are not as strong if they're on these medications for long. So the moral of the story is, if you have a gastric problem, you want to maybe use medicine for the short term to control things, but in the long run, fix your gut. That's where people like myself and Vic can help you, because we do more fixing, doctors do more prescribing. Now, I'm a doctor. I understand when to use the prescription. I also understand when not to use the prescription. And in most cases, you want to be able to fix it, and you can't fix it with the drug generally. You can control it with the drug, but you cannot fix it with the drug. So there's where the nitric oxide is so important. But nitric oxide is even more important than that. It is also an antioxidant. So it's the lack of nitric oxide creates a pro-oxidant environment in your blood vessels, which is where the stiffness comes from, amongst other things like elasticity and adhesion molecules, things like that. So nitric oxide is not the thing that the gym rats are all about. It's not just arginine. It's understanding that your diet has to be on point. Your gastrointestinal system with the right acid in the stomach has to be on point. So diet, the right acids in your system, and then some moderate exercise. Those are two of the ways that, and there's a third way. And the third way is supplementing. The supplementing, that's what we say, arginine gets converted to citrulline, and citrulline gets converted to arginine. And as it shuffles back and forth, you release nitric oxide. So that's the dietary way. Yeah. And there are three types of enzymes, which I won't go into. But it shows you the importance. The most important enzyme is in the endothelium, your blood vessel. That's probably the most important. Even your nerves have the same NOS enzyme, but only in the nerves. And there's something called inducible NOS. So I said I wouldn't say, I had to say it. There are three types. And that one is to actually attack invading parasites and infection. So your nitric oxide is your friend. It can be your enemy. So you've got to take care of your nitric oxide.
Yeah. So I'm currently working through a course on Hashimoto's. And for people who aren't familiar with Hashimoto's, more people may be familiar with the term hypo or hyperthyroidism. So just as an overview, hypothyroidism is essentially when your thyroid doesn't work properly. Let's just leave it there. The difference between hypothyroidism and Hashimoto's is that Hashimoto's is hypothyroidism in conjunction with some significant autoimmune issues. And a lot of times those go undiagnosed. But the reason that I started thinking about that was you mentioned how important it is that people are able to digest their food. How do you feel about folks supplementing, whether short-term or long-term, out of need? Maybe they've gone and seen somebody who's told them, hey, you really don't produce enough stomach acid, so you're having trouble digesting food. How do you feel about people supplementing with HCl, hydrochloric acid?
Yeah. So we actually use betaine hydrochloride for multiple health benefits as part of the acid in combination with the digestive enzyme. So when I have a product, everything that I have is called Next Something. So Next Digest. And in order to help with the digestion, not only do you need digestive enzymes, but you also need betaine hydrochloride. Now, the beauty of betaine is that it's a methyl donor. Now, for people who don't know what that means, your body works through absorption and detoxification and genetic expression. Well, you need methyl groups for methylation. And methylation is one of the core principles of life and function. When you have defects in it, you get more cancer, more heart disease. So when you have betaine hydrochloride, that's trimethylglycine, that's the three methyl groups. They're methyl donors. So those methyl donors and the acid, it's betaine hydrochloride. You've got the acid, you've got the methyl groups. The methyl groups are your supporting your detox system, and the list goes on. So that's how I give the digestion.
So yeah, you're on board with that. Okay. And that was just curious because when I'm working with a client who actually I think is suffering from Hashimoto's undiagnosed, and her body is screaming. And to your point, something that you touched on earlier is, we try to fix, quote unquote, fix with our current paradigm in medicine. A lot of times with pharmacology, we try to fix problems with medication. The problem is your body is just going to find another way to try to let you know that something's wrong. So again, like say you have high blood pressure, you get on medication for high blood pressure, it resolves, or at least temporarily resolves the blood pressure issue. But now your body is going to figure out another way to try to send an alert, to try to raise red flags. So now maybe you start having other symptoms that you weren't having before because your body is trying to let you know that something needs to be changed. So this client, she's been seeing the same physician for 30 years. She's been on thyroid medication for 20 years, and I'm looking at her labs, and her labs have these clear indications of things are on a trajectory, and she's starting to experience more and more symptoms that are pointing to other autoimmune issues. And her body is essentially, for those who aren't really familiar with the term of autoimmunity or what an autoimmune disease is, it's essentially your body starts to attack itself. That's what happens. It starts to recognize things internally as invaders or as problems, and it starts to attack itself, essentially. Would you say that's a fair?
Yeah. I mean, if I can just jump in,
Sure.
I think the operative word is function. And when the function starts to go down, you have to ask yourself, particularly with the thyroid, are your minerals in order? Because if you don't have the right amount of zinc and the iron and the selenium, then not only can you not make the thyroid properly, but you can't convert, say, T4 to T3.
Yeah.
The difference between the two is that T4 is in the body, in the bloodstream, and the T3 is intracellular.
Yeah.
Were you going to say something?
No, I was just going to say one form is very well metabolized or metabolically active, and the other's not. Right, between
intracellular. So
sure. So for her, if she was local, I would have her come into Next Health and have her do an executive physical. But where we've started is I've sent her a couple of at home food sensitivity tests that she could consider taking. I really think that if she's interested and willing to do it, she should do some sort of GI analysis.
Well, I was going to go there. So as the function is going down, you have to ask the questions why, right? It's either deficiencies and overall ill health, or as you pointed out, most of the thyroid disorders are some degree of autoimmune dysregulation, and then eventually it may be a disease. We diagnose a disease like Hashimoto's is an underactive thyroid, Graves is an overactive thyroid through antibodies. As you said, it's an autoimmune disease, so your own antibodies start to attack it. So in Hashimoto's, you have antibodies that damage the thyroid. With Graves' disease, you have antibodies that stimulate the thyroid. And so if you don't have the antibodies, doesn't mean you don't have function. It just means that the level of dysfunction hasn't got to the disease. Yeah, and you could start off with low function, having symptoms like less energy, weight gain, thinning hair, constipation for underactive. And for overactive, it could be anxiety, tremors, weight loss, sweating, cold intolerance, or heat intolerance, sorry. So the idea is that the function is always the first thing to go down. And then the antibodies may not be at a level to be detected to call it a disease. But if you don't change something, and so the function can also go down because of just ill health overall, and not the right amount of minerals is very, very important. And part of that is also iodine to have the building block. So I think that, the signs of autoimmune dysregulation are weird rashes, pigmentation, when you have other non-specific symptoms that you can't explain, aches and pains. Now, all these are going to happen more for people who don't sleep properly, who put processed food into their body, who don't put the right foods to nurture the bacteria in the gut. So the bacteria hate processed food. They hate the good bacteria, hate refined carbs. And so when you want to have good immune system, you need to have a good, healthy gut. And so I'm going to talk about exercise in a second. And that you have to nurture by putting in the right foods, not for yourself, for the microbes. A diverse diet in fibers, diverse microbes, lower inflammation. A narrow processed food spectrum, narrow diversity of good bacteria, more inflammation. Now, talking about exercise, and now I lost my train of thought again.
That's okay.
Damn, I wanted to really bring that up. It'll come to me.
That's okay. It'll come to you. So so with her, we're working through some things, and I wanted to just touch on that, so that if there's anybody who's listening who's suffering from, like you said, any number of things, that they're not really sure what to do or where it's coming from, they've spoken to a physician, you should start sort of at the root. Try to get some comprehensive blood work done. Look at how your gut is functioning and what sort of environment.
I got to tell you this before I forget now.
Sure.
So if we talk about stresses, in fact, most of the positive responses are for temporary stress. The word is temporary stress. Chronic stress is damaging. Temporary stress is the frontier of medicine, not just for good health, but actually to address disease. So when we have too many stresses, you didn't sleep at night, you didn't have, you're fasting, and then you work out, and then you have more stress. And then what happened to me was I had so many stresses because I'm thinking, more is better, right? I can fast longer, I will work out harder, I obviously don't like to think I have stress at work, but I probably do. I have family, and then I got leaky gut. I just want to throw that in there.
Sure.
So, but that should be part of, don't overdo anything. And even I myself found myself overdoing it. But, I'm one of those people, I have to make my own mistakes. Now I learn. Now I understand what I'm saying to people. So I think we go back to what we said, moderation, and that the food you put in is very, very important, and it has to be balanced. Your food has to be balanced, your exercise has to be balanced, your sleep has to be balanced.
Yeah. Well, and again, we could go on and on about all of these different things, but so far we kind of gotten through what we do first thing in the morning, how we like to generally approach our fasting, and some touched a little bit on how we generally like to eat and when we like to break our fast. We talked about when and how and why we train the way that we do. But one of the things that we did talk about, and I want to touch on it just a little bit more before we run out of time, is sleep, right? So we got through the day, we've accumulated all these different forms of stress in life and stuff like that. And at the end of the day, we have to recover from that. So one of the most important things is quality sleep. Over the course of the day, with all of the thinking and decision-making and stress that we experience, our brain starts to accumulate these amyloid plaques. And these things are meant to be cleared out of the brain during certain phases of our sleep. And when we don't get adequate sleep and we don't get quality sleep, we don't really get to go through that cycling and cleansing process. And then long term, that can have all sorts of negative implications, everything from dementia to other physical manifestations, so on and so forth. So in order to get quality sleep, what has your strategy become over the years?
Yeah, let's just give a little bit more scariness, some scariness into our clients, right? So if you don't sleep enough, you're going to get more dementia. At the very least, you're going to get cognitive decline. So, and people who don't sleep, like sleep apnea patients who have disrupted sleep, they have what we call low testosterone, right? Because sleep is that important. Now, as you correctly said, you have any cell that has metabolism has to have byproducts, and those byproducts accumulate. And like in the brain, you have 20% of the metabolism is in the brain. There's a lot of byproducts. That's natural, but the sleep is the time to get rid of them. So we're going to talk about how to get the best sleep, but let's talk about what happens during the sleep. Okay. In fact, your brain is more active during sleep than it is in the daytime. And what it is that when you're in an MRI and with an EEG, they've actually measured more electrical activity in the brain as you go through the different sleep cycles. As you have electrical activity, your blood vessels are now opening and closing. Electrical stimulation is actually activating blood flow. Now, that blood flow, it may be part of the benefits of sleeping, right? You're sleeping, going through the different sleep cycles, your blood is flowing. In fact, they actually see the fluid around the brain, we call it the cerebrospinal fluid, CSF. As the blood vessels open, they push the CSF. As the blood vessels relax, the CSF moves in a wave-like manner. So they've visualized this in the MRI, and they're measuring the electrical activity, pushing the blood, opening and closing it, or dilating and relaxing, and moving the CSF in a synchronous manner, which is related to a person waking up feeling rested. Remember I said about quality sleep, not just quantity. So if you go through the different sleep cycles, then the waves of CSF will determine a less toxic brain. So in the morning, you wake up refreshed. And that also can only happen if the brain temperature drops by 3 degrees. And so in order to get good sleep, you need to make sure that you don't eat too close to bedtime, because when you eat, you have thermogenesis. Your body's getting hotter. Your brain is going to get a little bit hotter. If not the brain getting hotter, your body will stop the brain from cooling down. So that's why you have better sleep if you're in the cold environment. You have better sleep if you stop eating at least 2 hours, if not more. And so some of the foods not to eat is the high glycemic foods, because you mentioned multiple times insulin surges. So insulin is a regulator of energy. So if the insulin surges, then you can create dysfunction in hormones. You can create dysfunction in fuel utilization in the brain, leading to dementia. You can have dysfunction of energy in the blood vessels, so you get more plaque buildup. So these surges of insulin happen if you have a lot of carbs. And some of those carbs are fructose if you eat a lot of fruits. So don't eat fruits close to bedtime. Certainly don't eat desserts and so forth. If you're going to
Oh,
eat
it's the best
fats.
time.
Yeah, yeah, I know that's what it
It's
is.
the
If you're
best time.
relaxing, you're
Right.
grazing. And
Yep.
so I mean,
Yeah.
these are things that you have to figure out how to, don't
Yeah.
buy the chips, because if you buy it, you're going to eat it.
Sure.
Have nuts available. Ideally, less salted the better. So yeah, those are some
Well,
of the things.
and let's be honest, right? We're all humans and we all slip and fall sometimes. But let's just say on an ideal evening, starting 3 hours out from bedtime, do you have a sort of I do personally, do you have a protocol for how you sort of approach those last few hours, like things that you
Yeah.
absolutely try to do? And
Well, yeah. Well, the beauty is now I'm in the month of Ramadan, so I'm a very disciplined person. So I'm
okay.
fasting, no food, no water all day long.
I thought it must be the Muslim Center of Richmond. This morning when I was headed to a 5 a.m. client was
Yeah.
packed, and
That's
I
right.
was
That's
thinking, I was
right.
like,
We start
is
our
this
prayers. Yeah.
yeah, okay.
Before sunrise. Yeah.
Okay, yeah. So for you right now is obviously a very unique time where you're probably
Yeah.
being even more strict. But let's say outside of the
Yeah.
holiday, how do you typically approach those last few hours before bed?
Yeah. Look, I mean, so you're trying to wind down. So you got to find ways to relax. Now, sometimes it's watching the news and so forth. But you and I know that watching too much TV or the digital blue light, these are going to disrupt our melatonin receptors. So, if you can try to limit that, you stop that way before bedtime, 1 hour at least, I think.
Mm-hmm.
I don't think 20 or 30 minutes is going to cut it, 1 hour.
Mm-hmm.
It's so variable. You can't give a fixed number. The longer you can cut it out, the better. So do whatever you can. The best advice that I can give people is that if you're going to bed at midnight, go to bed at 11:30. If you're going to bed at 11:30, go to bed at 11. If you're going to bed at 11, go to 10:30. I say that precisely because 30 minutes is doable for most people. If somebody's really difficult person, I say 15, because I want people to achieve the goal so they can move to the next goal.
Right.
So 30 minutes is doable. So I don't mind whatever time you go to bed, 30 minutes early. The science shows the circadian rhythm, which shows that blood pressure is better controlled when people go to sleep at 8 p.m. and wake up at 4. Now, nobody goes to bed at 8 and nobody wakes up at 4 unless they're doing some weird shift. However, if you can stay close to 9 or 10, you're on the better side. And now you get to 11 and 12, you're on the wrong side. Gotcha. And it's as simple as that. The duration of the sleep is not as important as when you sleep.
Yeah. There's many mornings when I'm up at 4, but I will admit I wasn't to bed by 8. So I want to work on
exactly.
that, 2 young kids and a busy day.
Yeah. Well, I think that what people need to understand is that what we want is a discussion like this so we can give many examples. So it's not going to be cookie cutter. What we're giving is general advice. And so we discuss challenges. So what we want to do is talk about all the variabilities over time. So as we talk about similar fields, sleep, eating, fasting, but we're going to put a different spin on it. The challenges, when you're doing well, what sort of sabotages you, right? Mm-hmm. What makes it challenging? How to get back on it? I think these are stuff we'll talk on the next episode, frankly. But the thing is, you're exactly right. I think that the sleep is something we'll spend a little bit more time on it. But I think the studies, they're not extensive, but they're fascinating. Yeah. And if you understand it, you're going to respect it.
Yeah, we could definitely do an entire episode on sleep in and of itself, strategies for better sleep, education on what sleep looks like, the different stages of sleep, so on and so forth. But I'll leave everybody with one additional rule of thumb that they can try to implement. Something that I heard somewhere at one point that I really liked and that I've tried to implement and seems to do pretty good, and it's very simple, is 3-2-1. So try to have no more solid food 3 hours prior to your target bedtime. If you supplement, which you and I both probably agree that there is some room for a good supplementation with the right things to actually even enhance quality of sleep. Now, personally, maybe not melatonin and sorts of things like that, but the right types of magnesium and some things may very well help some people get what they need in order to get that quality sleep. So no more supplementation, liquid supplementation, so powders, things like that, those other things that you might be using beyond 2 hours or closer than 2 hours to target bedtime, and then trying to shut down all screen exposure. And if you absolutely can't, maybe try to invest in an inexpensive pair of blue light blockers or something if you're going to still be on screen time, within 1 hour prior to bedtime. So if you just do those couple of things, and then in addition to that, try to keep your sleep environment cool, like you mentioned, make sure that you have a fan, or if you don't keep the temperature in the house particularly low, try to keep that down. If you can, you don't try to minimize any sort of Bluetooth, or, if you keep your phone by the bed, put it on airplane mode. Try to reduce some of those other wavelengths that are coming into the sleep environment, because I believe that there's some studies out there that show that there can be an impact on sleep when those things are present. So some folks have their entire bedroom set up with a kill switch. When they flip that bad boy on, every light, the cable, the TV, if you even keep a TV. Personally, I don't think you should keep a television in your bedroom. I think the bedroom should be for sleep. But the TV, anything else that emits an electromagnetic pulse is just turned off. I don't have that. I just try to keep it pretty simple. I turn all the lights off, try to keep it really dark, try to keep it nice and cool. I try to practice that 3-2-1. And one thing that really helps is I really try to, particularly if I'm having trouble falling asleep, I tried to fall asleep with breath work, meaning I try to really focus on something like box breathing, or some sort of really slow, deep nasal breathing, and even some counting with that, to further shift my body into that parasympathetic, rest or digest state, so that it's a little bit more geared towards restfulness and quality sleep, and putting it in a position to really benefit from the sleep as much as possible. So I'd say those few things. Try the 3-2-1 rule. Keep it cold, keep it dark, try to really calm down, maybe with a little bit of breath work as you're falling asleep. And then just to touch on that breath work, last thing from me, I promise, and then I know we got to wrap it up, but just going back very briefly to exercise. One of the things that I find to be really helpful with recovery and the effects that exercise has on me personally, and I picked this up from somebody not too long ago, is, you get a workout, and especially if it's a good workout, it's been intense, and especially if you've got things that you're trying to do afterwards, you kind of leave the gym in a hurry, you're all pumped up on adrenaline, you're feeling good, you're rushing around, and you're riding that wave. Actually, instead of doing that, try to take 2, 3, 4, 5 minutes of slow, controlled nasal breathing to bring your body back down to that rest and digest state. Because like you mentioned, we're not meant to be in that fight or flight, high, go, go, go mode all the time. A lot of us are by default because of the way that we live our lives and, the constant rat race. But we're really supposed to spend the majority of our time in that rest and digest, and then only shift into fight or flight when it's necessary. So, whether it's after a workout, or just midday when you've been having a crazy morning, or in the evening when you're trying to wind down for sleep, practicing some deep nasal breathing, slow breaths in through the nose and out through the nose, or out through the mouth, but big, deep, slow breaths where you're trying to relax and you're trying to get the body to sort of down regulate itself a little bit, I think is always a really good strategy, and can be really, really simple to implement and really, really effective, even if just for a couple of minutes. So, Doc, that's all I've got. I don't want to hold everybody, whoever's still listening at this point,
great advice,
everybody's attention. But do you have any closing thoughts?
No, I think that's great. That's great. I think I couldn't finish better. That's great. Implementing that would be a great end.
Okay. All right, guys. Well, again, appreciate all of you who are listening. We've gone over a multitude of things, and I'm sure with time we'll plan to go through each one of those in more detail. But this is Coach Vic. This is Dr. Habib signing off for Next Health. We appreciate all of you, and we look forward to talking to you guys again soon. Doc, have a great weekend. Enjoy the family. I'll talk to you soon as well.
Likewise. Take care. Bye-bye.
Bye.